Welcome to South Florida Weekly. I'm Karen Curtis, and right now I am joined by Dr. Jodi Schoenhaus, who is with the Boca Raton Foot Care Center in Boca Raton. Welcome.
Thank you. Happy holidays.
Happy holidays, and we want to keep the holidays happy, and we want to have a prevention session here to help people from sitting too long in one place, say on an airplane or watching football, where they might develop a deep vein thrombosis like poor Dave Bloom, who died during the Iraqi war after sitting in a tank for too long.
Absolutely. It can be something that's very harmful to you, and prevention is a great way to look at this.
So what would you suggest?
Well, it's very important that people understand what is going on. So when you sit in one place for too long, blood stays stagnant or does not move in the legs. It sits in the veins. And veins in the legs really rely on your muscle pump when you walk to keep flow going and bring the flow back to the heart. Unfortunately, when you do sit in one place too long and the blood pools, that can cause what's called a clot, or people may have heard of a DVT, or deep vein thrombosis.
Right.
That can break off, travel, get stuck and lodged in the lungs, and then disaster. And then what you have is called a PE, or a pulmonary embolism. And unfortunately, that's what took the life of Mr. Bloom.
Didn't Serena Williams have one of those?
She had yes, absolutely, she did. She had a clot in her leg, and it just goes to show you, even someone who's very active can develop one.
Very interesting. Now, what do you suggest for people on airplanes? What should they do if they've got a long coast-to-coast flight?
Well, first off is knowing who is at risk. Certainly, weight is a factor. So if you're overweight, you're at a higher risk. Okay. If you're a smoker, you're at higher risk. And if you're on birth control pills, you're at higher risk. All of these factors play a role. Once you are on an airplane, I should also say anyone who's in a cast or a walking boot is also already at risk.
Okay.
So once you're on an airplane or you're traveling or going a long distance in a car, a couple of things. One, get up and walk around.
Okay.
Park the car, get out at a stop, walk around. If you don't have that luxury to walk around, at least do exercises with your ankle. And I know it sounds crazy, but I have my patients do the alphabet, uppercase and lowercase, with ankle motion.
Okay.
And that's just a good way to stay focused so that you can put and move the leg and get that muscle pumping.
Okay.
Furthermore, you can wear a compression stocking. If you already have some swelling, or if you already are at risk, or you've had surgery recently, you might want to invest in a good pair of support stockings or compression stockings that can help as well.
Okay, so that they're not the most attractive.
No, they're not the most attractive nor the most comfortable, but really do make a significant difference.
Really? Okay.
Yes.
Now, is there any kind of an indication that there's a problem? Do you have any kind of symptoms? Does your leg go numb, or what can you look for?
There are some warning signs. Numbness is usually due to irritation on a nerve, whether you're crossing your leg. That's usually due to an irritation of a nerve that you just want to move your leg around. However, warning signs for a blood clot include swelling, redness, increase in warmth, and pain in the calf. Once it breaks off and travels, you can develop shortness of breath and chest pain.
Okay. Wow. Okay, so that's after it's traveled to the lungs.
Correct. And any of those signs or symptoms, you really want to seek a consult with a doctor, go to a medical express facility, or an emergency department.
What do they do for you once it goes to the lung?
Well, they would do a scan and put you on an aggressive blood thinner.
Okay. Does alcohol play any part in this?
It can. Sure, it can play a part. Alcohol, not directly on the vessels or on the situation. However, when we tend to consume alcohol, we tend to stay stagnant and just kind of chill out on the couch. and certainly it can interfere with your liver function as well.
Okay, Dr. Jodi Schoenhaus, also I want to ask you, does age play a role in this?
Age can affect things because as we age, we are on more medications. We tend to be less, more sedentary and less active. We tend to have more surgeries. An older, healthy individual is not any more at risk than a younger, healthy individual.
Okay.
But as we age and the more surgeries and medications and medical issues we have, yes, that can predispose you.
Okay, and what's new in the leg and vein procedures?
Well, it's amazing. Really, we've been talking about the deep system. There's two systems of the leg. The deep system, which we have been discussing, and the superficial system, which is closer to the surface. That is when people recognize that they have varicose veins or even spider veins. That, too, can be painful. Tired, achy, heavy legs, swelling, even sores or openings to the skin that can lead to infection. What's new in that world? Wow, it has come such a long way in the past decade. Most procedures and diagnostics are done right in the doctor's office. Basically, you come into the office, we do a physical exam, a diagnostic ultrasound, and then use laser or radio frequency to address the underlying condition. And the bulging varicose veins are eliminated as well.
Okay. What about feet and ankles as we age?
Yes, very important. Certainly as we age, you are at risk for swelling. Osteoporosis and osteopenia can lead to fractures and increased risk for trauma, arthritis, tendinitis. These are all conditions that we need to be aware of because, look, we want to be walking, active, and healthy for as long as we can.
Exactly. And what do we need to know about when we exercise, such as running?
Good, supportive sneakers, wearing the right shoes, the right socks, and knowing when not to work out. If you have any injury, you need to appropriately rest it or seek consultation with a doctor so that you don't make it worse. Those are very important and certainly very important to look for and be aware of. Staying hydrated, something else very key, especially living in Florida.
Okay. And how do we get in touch with you, Dr. Jodi Schoenhaus? What is your online connection?
Yes, my name, Dr. Jodi Schoenhaus, at the Foot, Ankle, and Leg Vein Center. I am located in Boca Raton as well as Boynton Beach.
Oh, okay.
And my website is bocaratonfootcare.com.
Fantastic. Thank you so much for all of this very vital information, and have a wonderful holiday.
Yes, happy and healthy holiday to you as well.
Thank you.